Hi, everybody. This is Tali, Berman, Autism Specialist. Here we are 3 of 4 members of our whole child team. Dr. David Berger is not with us today, but we got 3 of us here as an opportunity to really work together and share information. Today we're going to be talking about methylation. And so before we do, just want to give you guys each a moment to introduce yourselves. Patsy, you want to take a minute and introduce yourself?
Sure. Hi, everyone. My name is Patsy Giarda, and I'm a certified pediatric nurse practitioner, certified in primary care pediatrics.
Thank you. And Roni?
Hi, I'm Roni Enton-Visokar. I'm an individualized biomedical nutritionist.
Great. And for any of you who don't know, as I said, we're 3 of the 4 members of the whole child team. And Roni and I work together with children to really implement necessary diet intervention and therapeutic intervention. And Patsy is sort of the real point person who helps with the testing and then analysis of identifying exactly what the underlying medical issue might be. And today we are talking about methylation, so that anyone listening get a little bit more background about what methylation is. So maybe we just start right with that. What is methylation and MTHFR and the methylation pathway? I know we're not going to go too scientific here, but just enough so parents can understand what we're talking about.
Sure. So MTHFR and methylation are essential biochemistry level processes that happen inside of every cell of our bodies. So is the job that of methylation to produce DNA. It produces antioxidants, natural antioxidants. It can suppress inflammation. And MTHFR specifically is the spot on the DNA, as I describe it, that produces folate, or methylfolate, I should say, from folic acid. So it's the spot on the DNA that actually uses the folic acid that we consume through foods or through supplements.
Okay, and so the methylation pathway is describing what specifically?
So the methylation pathway is a series of occurrences that are needed for the body to produce B vitamins, and which provide energy. It helps to decrease inflammation in the body, and it also detoxifies. So it helps to our body to eliminate any toxins, including metals.
Pretty critical pathway, it seems, and with many important jobs to do.
Yes.
And so can you talk a little bit about methylation mutations and how this might affect kids with special needs?
Sure. So if there is a mutation on any of the segments of the methylation pathway, and there can be more mutations throughout the pathway than just MTHFR. MTHFR is one of the more commonly known methylation pathway stops, so to speak. But there can be mutations throughout that can disrupt the body's ability to regulate hormones such as serotonin, dopamine, which can cause issues with behaviors, depression, anxiety, and then MTHFR in itself, the methylfolate that our bodies need to produce. If there are mutations on the DNA, our body's not creating enough of that methylfolate to then go on and do the next job in the pathway, so to speak. So if there's not enough methylfolate, our body is not capable of detoxifying or ridding our bodies of inflammation in the way that it needs to, or that it should.
Okay, so from like a parent's perspective, sort of similar to what we did with Candida, what would be some red flags? What are some symptoms or indications that my child might have a mutation in this? Is that what we're looking for, basically a mutation in this process or a defect in that process? It sounds like this might be a trickier one because it's so broad in its function and so broad in what it does. So what are the kind of things parents can look for that might tip them off that is something to investigate for their child?
Sure. So I like to start with a good family history and like to find out if there are, because with some children, there are not always red flags early on. I've done a methylation pathway analysis for children as young as 1 year old, and we may not see any physical symptoms in children at that age yet. but we like to check with a family history if there's any family history of, so this goes along with any issues with the child, but allergies, any type of atopic illness, really, asthma, eczema, history of autoimmune disease, or if the autoimmune disease is present within a child. And there can also be issues with regulating emotions, with anxiety, depression. Those are sometimes, those are big red flags for us that we need to check out the methylation pathway.
Sort of emotional dysregulation, anxiety, and depression, did you say?
Yeah, absolutely.
Okay. You mentioned something also. Hold on 1 second. You mentioned something also in terms of energy. And I'm wondering if another indication or red flag is children who seem like really lethargic, who have a hard time moving, who have a hard time sort of motivating themselves. Would that possibly be an indication for that as well?
Absolutely, because most of the B vitamins are produced through that pathway, or regulated, should I say. They're needed on the methylation pathway. So if we are not using the B vitamins correctly, where some of our energy is sourced from, then that can impact the energy in the child, for them to not have the energy to exercise, to perform the daily functions that they need to do.
Okay. Roni, do you have anything to add that you've seen in terms of symptoms or red flags that might indicate that a child has challenges with their methylation process?
When Patsy said that, I was just thinking about how many families have told me, my kid, it really needs the time to just veg out on the couch in front of the TV. It's really hard to get them motivated to get going. So it's interesting. I also think a lot of times other issues might be going on, but definitely methylation is key. Definitely should be checked out. I know Patsy will get more into that, how that's done.
Okay, great. I know I can think to myself, there are kids that I know who just kind of like lie around a lot, and that's sort of why I brought that question up. Kids who you really have a hard time sort of getting up and engaging, they just don't seem to have the energy to do it. So what would you say then, Patsy? What's the kind of testing that will be done to learn more about if that's really the case?
Sure. So I really like to find a good, reliable saliva test that will give us a full methylation pathway reading, so to speak. It'll let us not only MTHFR, but it'll let us know MTRR, which regulates B12, COMT, which regulates a lot of the hormonal sides of things that can impact energy and emotions more than others. So full methylation reading, and then if a parent is or in an area of the country or unable to do the saliva screening, then there is capability to go through blood work as well. And MTHFR and MTRR specifically are able to be done through blood work.
Okay, so either saliva or blood, depending on what their availability and accessibility is, where people might live.
Yes.
And then, so what's the treatment? So if it's confirmed that that's actually an issue, it sounds like such a broad, so broad in its scope in terms of its impact. I'm curious to hear what the treatment for that is.
Sure. So the treatment for anyone with a methylation mutation, whether it be MTHFR or otherwise, it really comes down to the specific mutation itself. If there's an MTHFR mutation, then there needs to be support with the methylated folate. Methylated folate comes in the source of 5-MTHF or through folinic acid. And those two are crucial for the body to use the pathway effectively. And then there are other things, SAMe, there's methylated B12, there are other methylated sources that we can recommend if there are other mutations within the pathway.
Okay, great. So you'd have specific recommendations depending on what the mutation actually was and where a child needed that kind of support.
Absolutely, yes.
Okay, so I think we'll wrap up this one similar to what we did with Candida, which is I'd just love to hear from you, Patsy and Roni, if you have anything to add of the kind of changes that you've seen with children who've then had a methylation mutation that's been treated, and what kind of changes you've seen once that treatment occurred.
Sure. So firsthand, I've seen children that have been better able to regulate their emotions first and foremost. So they are able to control their anxieties. They are able to have more energy so that their depression seems to lift. The fog seems to lift. That's one of the biggest things that I see with good methylation correction.
Great. Great. What about you, Ronnie? Anything you want to add in terms of what you've seen?
I agree. That's exactly what I would have said. Yeah. The greatest changes are in mood typically.
And do you see then kids also who have that real low energy begin to sort of like have more energy? Do you see a real impact in that area as well? Or either one of you want to take?
Yes, sure. Yes, absolutely. Yes. I do see them with more energy. They're living their best lives, so to speak. They're to play. They're able to best function in school and get the most out of their day, whether it be education or play, both equally important.
Great. Excellent. So thank you all for your contribution and sharing your experience and wisdom around methylation. I know for many parents, all this can be quite a mystery, and I think can be really reassuring and hopeful to know that there are oftentimes underlying medical issues that can be identified and treated, so that, as you said, Patsy, your child can live their best life. I love that. Great. So we will wrap this one up, and our next video we'll talk about Clostridia. So we will see you then. Thank you. Bye, everybody.
Thank you. Bye.